Dominica welcomes a new Chinese ambassador. The AIDS unit says behavioral change is key to reaching the goal of zero. And Prime Minister Honorable Roosevelt Skerrit has reached his 10th anniversary as the country's leader. Thanks for joining us on National Focus. I'm Jarna Hector.
And I'm Fontaine. Stay with us for details of the headline stories and others right after this.
If you can believe this.
Come by my house and let me show you some movies.
Why can't you believe this? Some mothers don't believe their own children when they say they've been sexually abused, and they don't report it. Remember, if anyone asks to see or touch their private parts, touches them inappropriately, shows them or forces them to touch one's private parts, has sex with them, shows them pornographic material, or deliberately lets them hear or see the act of sex, then it is sexual abuse. Believe your child and report the sexual abuse. For more information about child abuse, contact these agencies.
Thank you for staying with us. 10 years after taking on the responsibility of serving as Dominica's Prime Minister, Honorable Roosevelt Skerrit is being described as one of the most dynamic and versatile Prime Ministers that Dominica has ever had. Acting Prime Minister Honorable Reginald Austrie made the observation on Wednesday, exactly 10 years after Prime Minister Skerrit took up position as the country's Prime Minister. In an exclusive interview with GIS News, Honorable Austrie recalls that Prime Minister Skerrit was thrust into the position of leading the country following the sudden death of Honorable Pierre Charles back in 2004.
The circumstances under which Roosevelt Skerrit became Prime Minister is well known to everybody. Totally unprepared, because he came in as a replacement of Pierre Charles, who had died suddenly. So there was no time for preparation for that position. He was also very, very young at the time. And while he may have been involved in local politics, he was not on the national level.
Looking back on the performance of Honorable Roosevelt Skerrit as Prime Minister from 2004 to present, Honorable Austrie describes it as simply exemplary. He says Prime Minister Skerrit, through his leadership, has been able to expand on many programs and policies undertaken by his predecessors, Prime Ministers Roosevelt Douglas and Pierre Charles.
The work that Skerrit has done is amazing and truly, truly impressive. In fact, it's like a miracle and like a God and a savior to us. What he was able to do was to continue the work that was started, like I've said, under Rosie Douglas and Pierre Charles, but even to expand it to the fact that today we can say that Roosevelt Skerrit is probably one of the most dynamic and versatile prime ministers that we have had in this country.
The development of social programs to cushion the impacts of the global financial crisis has also been identified by Honorable Austrie as a hallmark achievement of Honorable Skerrit. Honorable Austrie spoke of the major achievements that Honorable Skerrit has been able to make in advancing Dominica's foreign policy.
But Roosevelt Skerrit realized that our traditional foreign partners was not going to be sufficient to take us through this very difficult and challenging period, because we were still under austerity mode at the time when he became Prime Minister. And he realized that we had to think outside of the box. We had to do things differently, which attracted tremendous criticisms from various circles inside and outside of the country. Like, for instance, his moving from Taiwan to China after 21 years was heavily criticized. But today, even the opposition is now beginning to say that if they get in, then they will do what Skerrit did 10 years ago to establish diplomatic relationship with China. And the evidence of the benefit of that relationship is very, very clear for all and sundry to see.
Prime Minister Honorable Roosevelt Skerrit was the youngest head of government in the world when he took office on January 8, 2004 at the age of 31.
In more news, the new Chinese ambassador accredited to Dominica, Mr. Li Jiangning, presented his letter of credence to President Charles Savre on Wednesday morning. At the ceremony, President Savre congratulated Ambassador Jiangning on the commencement of his term. The head of state expressed hope that the close bilateral relations existing between the two countries would be enhanced during the tenure of the new Chinese ambassador, highlighting that this year marks the 10th anniversary of the establishment of diplomatic relations between Dominica and China. President Savre underscored the high priority accorded by Dominica to strengthening ties with China. President Savre also took the opportunity to highlight some of the areas where Dominica has benefited from its relations with China.
Your Excellency, since the establishment of diplomatic relations in March of 2004, Dominica has benefited and continues to benefit significantly through fruitful bilateral exchanges and cooperation in infrastructural development, education, health, agriculture, trade, and other areas. A number of technical and economic cooperation projects funded by the government of the People's Republic of China through grant funding and soft loans are underway in Dominica. Among these are the soon-to-be commissioned State House complex, the ongoing redevelopment of the State College, the construction of apartment complexes in Bath Estate and Emsall, the construction of the Newtown Primary School, the fourth phase of the Windsor Park Sports Stadium Technical Cooperation Maintenance Project, the supplementary engineering works on the Eole Blanc Highway to include bus shelters, two of which are nearing completion, the Carib Territory Housing Project, which is also nearing completion, the ongoing third phase Chinese Medical Cooperation Project, assistance for disaster recovery, including replacement of the York Valley Bridge, destroyed by a torrent of flood waters unleashed from the collapse of the Matthew Dam in July of 2011, and the construction of the new Princess Margaret Hospital, scheduled to begin in 2014.
President Savre expressed Dominica's interest in exploring new markets in China and enabling a source of tourism revenue through the recognition of Dominica as an approved destination. Meanwhile, Ambassador Jiangning said he is committed in his capacity to take the relations between Dominica and China to new heights.
I'm greatly honored to be appointed Ambassador Extraordinary and Plenipotentiary of the People's Republic of China to the Commonwealth of Dominica at this special moment. During my tenure of office, I will exert my efforts to further develop the friendly relations and cooperation between our two countries and the friendship between our two peoples. I firmly believe that in carrying out this important mission, I shall receive the support and assistance from Your Excellency and your government.
Continuing in this regard, the new Chinese ambassador emphasized the progress made by Dominica in economic and social development. He further stated that China appreciates the positive stance taken by Dominica to respect the One China policy.
Since the establishment of diplomatic relations in 2004, our two countries have enjoyed frequent high-level exchanges, ever-increasing political trust, fruitful cooperation in business, culture, health, agriculture, and other fields, as well as mutual support and close cooperation in international affairs. China highly appreciates Dominica's firm commitment to the One China policy and stands ready to work with your side to take our bilateral relations to a higher level.
The new Chinese ambassador replaces Ambassador Wang Zonglai, whose stint ended in December last year.
To reach the ultimate goal of zero new infections, the National AIDS Response Unit says behavioral change is absolutely necessary. National AIDS Coordinator Julie Frampton told GIS News on Wednesday that the issue is always a constant and grave one, especially for the unit.
HIV will always be serious. HIV will always be serious, and it's not going away. It's not going anywhere. We continue to see new infections every year. We do not have the final total for 2013, but as far as what I have documented cases for 2013, we have 13 new cases. For For the first half of the year, we had 7. And then by the end of December, we had another 6. Well, we may have a few more confirmations that might come out now that were identified in 2013, December, thereabout. But for now. So every year, on an average, we have between 15, 16 new cases. Last year, we had 19, you know. So every year, we see new cases. So HIV ain't going anywhere. Why? Because people are sexual beings.
Frampton says information is always readily available and accessible. However, that information must be transmitted into lifestyle change in order to realize results. Meantime, the National AIDS Response Program remains mobilized to tackle the issue on a national scale.
We never stop reminding people and informing people wherever possible. We do trainings with schools. Most of the teachers have been trained on how to present information to young children. Quite a few of them have been trained, the pastoral care teachers, guidance counselors. We've had gender and HIV training with them. We also, where possible, our staff is small, so where possible, we go to schools, churches, community groups, workplaces. We had a workplace program that ran for a while. Possibly that can be repeated. So we've been in the community, and what we've done is train persons from the community. So we have pastors who are trained as testing and counseling providers, So that's the way to go in terms of sustaining an HIV response, ensuring that everybody is involved, that everybody understands the implications of an HIV diagnosis. It's not just saying that treatment is available, and I can get infected. No, that's not the point. The point is preventing yourself from becoming infected, and that's what we want people to do.
On the subject of HIV testing, the AIDS coordinator emphasized that numerous avenues exist to facilitate the process.
Well, usually every June, end of June, 27th of June, thereabout, is regional testing day. So all the countries in the Caribbean will test across the board. That's an activity in collaboration with Scotiabank and the Pan-Caribbean Partnership Against HIV and AIDS. Outside of that, in Dominica, we do testing every day, basically. We have testing sites. Our goal was to have a testing site where persons can walk in, get their counseling, get their test done, and their results turnaround time within an hour. And that is happening in all our 7 health districts.
In addition to those centers, the Planned Parenthood Office and the AIDS Response Unit also serve as testing centers. The unit's plan is for all sectors of society to collaborate to reach the goal of 0.
And let us together get to 0, our theme, 0 new infections. Getting to 0. 0 new infections, 0 AIDS-related deaths, and 0 discrimination. If we can do it together, we can achieve 0.
We have with us here Nurse Julie Frampton, coordinator of the AIDS Response Unit. Welcome to National Focus.
Thank you, and it's nice to be here.
So we just saw in this story the importance of testing for HIV/AIDS, and let's look at the process of testing. Can you tell us exactly how it works? I show up at your office or at one of the testing centers, and then what happens?
Okay, so you don't test for AIDS, you test for HIV. So for an HIV test. So if someone wants to have an HIV test, they walk into the health center or to their doctor or to the National HIV and AIDS Response Secretariat and say, I'd like to get an HIV test. Or it can happen the other way around. Your provider, whoever your doctor, your nurse is, may offer you an HIV test. Have you ever been tested? Would you like to get an HIV test? Right. So when that happens, either way, you must, it's not should, you must receive pre-test counseling. And that entails looking at your risk behaviors, looking at how you can minimize risk, looking at what is this test all about, what is a window period. If you test now, do you need to test again 3 months down the road? Looking at who would know your results in the event that it's positive, what services are available to you in the event that you become positive. So what kind of care that you will receive, what treatments are available. So it's a whole package. So we try to ensure that persons understand that, or we should try to ensure that persons understand that before you receive an HIV test.
I remember that I went to the AIDS response unit some time ago, and I told the administrative officer that I was afraid of needles, and she told me that needles are not being used. It was a little
Lancet, yes. You can have it one of two ways. You can have blood drawn, or you could have a finger stick. Just like a diabetic, you prick your finger and we take 4 drops of blood.
So for persons who might be intimidated by the process, there's really nothing to be afraid of?
No. What persons mostly are afraid of is the result. What the result is going to be.
So what actually happens if it's positive?
Right. So if you get a reactive test at your site, we do not say it's positive, because positive is when we take another sample and send it to the lab and confirm. We do a confirmatory process. So you receive your HIV test at your health center or at the National AIDS Program or at the Dominica Planned Parenthood. You get a reactive, the 2 tests. So we run parallel tests. So both of them are reactive. We will tell you that the test is showing there are antibodies to the virus. However, we need to confirm, so we take another sample. We're not telling you that you're positive, because there are certain things, sometimes chemicals, pregnancy can interfere with a result. So we want to confirm and make sure. So another sample is taken and sent to the national laboratory where an ELISA test is performed. And once that is positive or reactive, it's confirmed positive, and you are given that result. So usually we try, if it's reactive, we try and send up the sample the same day. So in a couple of days, 2 days, you get your confirmation back.
But people are not...
all negative results are given back right away within 45 minutes.
And people are not left to their own devices after they are told that, something is off?
No. You come back. You have to come back. You are given the 2 days or 1 day, whatever it will take for us to get the confirmation. Usually it's done quickly, within a week, let's say. And then persons can get their... but by that time, you know already that you had 2 tests run parallel that were reactive.
Right.
So more often than not, that is almost like a positive result, But we really want to give, when we give people back a result, we want to ensure that we're giving them a correct result, so we run the confirmatory test.
Is there some kind of support that is provided?
Yes.
Afterwards?
There's the clinical care team, where there's a nurse, a doctor, the social worker, the counselor, that provides you with that level of service, that support that is required. There are also support groups that the individual can join. And we also encourage persons that in the event you are positive, I'm sure there's one family member, if you don't want to tell all at the same time, you can progressively tell all of them. However, at least there's one that you trust, that you can tell, that will provide you with that support, remind you, go get your treatment, your follow-up. Your viral load is important for monitoring and seeing how well that you remain. We offer viral load testing, CD4 testing. We ensure that persons get the quality of care. Quality is very important to us. Quality of care that they deserve.
That was very insightful, Nurse. Thank you very much for your time and for joining us here on National Focus.
Thank you very much for having me.
Moving on. Headed by Dr. Griffin Benjamin, staff of the Acute Psychiatric Unit in collaboration with the Hilltop Singers will host yet another APU concert this Sunday. Since its conception in 2000, the event has been a platform for the unit's patients to showcase their talents to the larger public. According to Dr. Laura Esprit, an objective of the APU has always been to, quote, treat patients and send them back to society to live normal lives. Thus, this initiative to involve patients in everyday activities.
Like any other illness, mental illness can be treated. So that's why I mentioned earlier that we admit, we treat and discharge. All right, so it's no longer the provisions where patients are kept on the unit for years. No, we treat like if you have diabetes, you come in to the ward, a normal ward, you are treated, you get better, and you are discharged. And the thing about mental illness, it varies, it goes across all ages and across all socioeconomic status. So you have from the very poor to high persons of high socioeconomic status suffering from mental illness. And what we try to do in an effort to decrease the stigmatization, we try to integrate them back into their communities where they are loved, where they are appreciated by their families. Because at the end of the day, persons with mental illness is just an illness, but they are human beings. So there's no need to fear them. They're sick, they get treatment, and then they go home to be loved by everybody else.
In an interview with GIS News on Wednesday, occupational therapist Shasta Green revealed hopes that the concert will attract a large audience.
Singing, dancing, doing poems, whatever it is that they want to do. Because though you suffer from a mental illness, it doesn't mean that you're no longer a person. You are still a whole person. So that in itself makes it better than every other year, because they're seeing that every year our patients are improving because we are doing a great job. We also have staff members, hospital staff members as well, and persons from the district health team. And we have many followers of very popular artists, as the doctor said, our local celebrities. For example, Halibut, one of his famous songs is Tongue Too Long, Don't Ask Me to Sing. We have Dice, Cicero Singers, Daddy Chess, Clint Henderson, Jean-Jacques, the young boy who can play 7 instruments. We have Johnson again from the hospital coming in order to let the person see how good we are.
Green communicated patients' excitement at the prospect of the concert. She says all proceeds will go to the objective of making life normal for APU patients.
There is a small contribution from the general public, only $10 for the adults, and the children pay $5. And of course, some persons may come and decide to give us $20, $30, and that's fine, because the monies that we receive, it goes right back into the patients. When the patients come to the psychiatric unit, it is as if they come to a 5-star hotel. We take good care of them. 3 meals a day, whatever it is that they need for their hygiene, haircut, we also take them out. We go on mini island tours, we go hiking, we go to Soufriere Sulphur Springs. Sports as well, we take them to the 2nd city of Dominica in Portsmouth, and we have sporting events with them. So this is where the monies that you will be giving us will be going.
Green believes that the concert will enable individuals to see patients of the psychiatric unit in a more positive light.
You don't want to miss out on this event, because many persons have a negative view of persons who suffer from mental illness. So when you come to that event, you're not going to see mental illness in front of you. You're going to see human beings. You're going to see persons, your mother, your father, your brothers, your sisters, your boyfriend, your husband. That's who you'll see, so come.
And CARICOM Secretary General Ambassador Erwin LaRocque has said he was profoundly saddened by the loss of life in St. Vincent and the Grenadines and St. Lucia and the destruction wrought by the floods, landslides, and high winds in those member states and in Dominica. In a message of condolence following the severe weather that affected the 3 CARICOM member states, the Secretary General extended sympathy to those who lost loved ones. He also gave the assurance that the community stood ready to render all possible assistance in the recovery and rebuilding efforts. In a statement released by the CARICOM Secretariat, the ambassador stated, quote, "On behalf of the community, I extend deepest sympathy to those persons who lost loved ones, were injured or displaced, or suffered damage to property, and lament the damage to infrastructure as a result of the severe weather." End of quote. He said further, the community's regional emergency response mechanism has been activated. As the process of recovery and rebuilding begins, I wish to assure those persons who are affected that the community stands ready to render all possible assistance as the member states seek to rebuild from the destruction. According to the statement, Ambassador LaRocque visited some of the affected areas in Dominica and has been in contact with the Honorable Dr. Ralph Gonzalez, Prime Minister of St. Vincent and the Grenadines, Dr. Honorable Kenny Anthony, Prime Minister of St. Lucia, and the Honorable Roosevelt Skerritt, Prime Minister of Dominica, as well as the Chairman of the Conference of Heads of Government of CARICOM, the Honorable Kamala Persad Bissessar, Prime Minister of Trinidad and Tobago. The Secretary General has held discussions also with Mr. Ronald Jackson, Executive Director of SIDEMA, and government officials who are involved in the recovery operations. And that's it for National Focus. Learn 2 more reasons why you shouldn't drink soda. Coming up next.
Do you have uncovered water storage drums around your home? Do you dispose of old tires, cans and old containers capable of holding water anywhere in your environment? Are you being bitten by mosquitoes, particularly at dusk and early morning? Do you keep houseplants in water? Do you spend your hard-earned cash to control mosquitoes? Has your community experienced dengue fever outbreaks? If your answer is yes to at least 3 questions above, you are at risk to dengue fever. Join the fight against dengue fever. The responsibility for a dengue-free Dominica lies with you. So, get rid of the Aedes aegypti mosquito.
There are literally hundreds of reasons why soda isn't healthy or useful. For starters, studies link soft drinks to high blood pressure, diabetes, heart disease, kidney stones, liver complications, osteoporosis, and heartburn.
On the environmental front, it takes 132 gallons of water to produce a 2-liter bottle of soda, and glass bottles, even if reused, take a lot more fuel to transport. Aluminum cans are only partially recycled, and the mining of aluminum has horrific environmental consequences. And just like bottled water, plastic bottled soda requires an enormous amount of oil to produce.
And that's all for this edition of National Focus. We always welcome your suggestions and comments. Drop us an email at gis@dominica.gov.dm or visit our website at news.gov.dm.
Friend us on our Facebook page and be sure to like our GIS Dominica fan page. You can also catch up on past National Focus newscasts on our GIS Dominica YouTube channel. On behalf of the entire news production team, I'm Jarna Hector.
And I'm Fontaine. Thank you for watching.